Often parents bring their child to my outpatient clinic or to an emergency healthcare facility telling, "Doctor, my child had seizures and my child is having high fever. I am so scared, I am petrified, I don't know what to do. So I have brought the child to you. So please do something, please do urgently, doctor," they tell me, and they seek my help. Hello, welcome to Dr. Akin Clicks, and I am Dr. Akin. Today I am going to talk to you regarding febrile seizure. Febrile means fever, seizure means fits in normal language, in normal term. I am going to tell you in detail what is febrile seizure. Febrile is basically having high temperature, body temperature, and seizure is basically fit, your child having fits. Seizure is basically abnormal body movements because of abnormal electrical impulse in the brain. You know, we have hypothalamus in our brain. The function of this hypothalamus is to regulate the body temperature. But when the body temperature rises suddenly so high, more than 101 degree Fahrenheit, then the hypothalamus is not able to cope up with the rise in temperature. Therefore, it results in release of abnormal electrical impulses in the brain, and so there is seizuring activity of the body, basically abnormal movement of the body. So here we are talking about febrile seizures in the children. We need to find out what are the causes of this fever. Very often the cause of the fever, febrile episode, is viral infection, especially human herpes virus 6. The child will be having fever and will have rashes all over the body. And the second is because of the influenza type virus H1N1. Because of these, the child will have fever. And the third, very often, which we see the cause of fever, is forced vaccination, especially when the children get measles, mumps, rubella, MMR vaccine, and diphtheria, pertussis, tetanus vaccine. After taking these vaccines, children mostly develop fever for 2 to 3 days. And when these fever are so high that they are exceeding 101 degree Fahrenheit and the fever is not controlled, then the child will have seizuring activity. So this seizure, because of high fever, is known as febrile seizure. The other cause of febrile seizure is genetic. The first degree relatives, especially if your parents have had febrile seizures in their childhood, then your child has more likelihood of developing febrile seizures. So, what are the types of febrile seizures? There are two types of febrile seizures. One, simple febrile seizure, and two is complex febrile seizure. In simple febrile seizure, the seizuring activity occurs only once within the 24 hours, and the seizuring activity can last from a minute to up to 15 minutes. So this is simple febrile seizure. In this, whole body, the upper limb, lower limb, whole body will have abnormal bodily movement, jerky movements, and you will notice there is uprolling of eyes, there is twitching of the angle of mouth, when there is febrile seizure, simple febrile seizure of your child. But in complex febrile seizure, the seizuring activity will be more than 15 minutes at a time, and within a 24 hours there can be another episode of seizuring activity. That is, there is recurrence of seizure activity in the child. This complex febrile seizure can have abnormal body movement of one part of the body. Either your child will have abnormal body movement of one limb or one side of the body, or one part of the body like one hand, one leg. So it is a localized seizuring activity. Therefore, you need to remember, in simple febrile seizure, it is only one episode of fever, and in complex febrile seizure, the seizuring activity can recur within the 24 hours. So, what to do when there is febrile seizure in your child? Obviously, when the parents are noticing for the first time having seizuring activity of their child, they will be shocked, they will be alarmed, they will be in panic. So remember that most of the children, more than 90% of the children, have only one episode of febrile seizure, and they do not get recurrence of febrile seizure. Remember that the age group of children who have febrile seizure is 6 months to 5 years. So when there is fever between the 6 months of age to 5 years of age, please be very careful and very serious. Please control the fever with antipyretic, which is easily available, or if it doesn't work, you do cold sponging, or you wet your child's body with cold water, or cold sponging you do. Don't wait for the fever to rise. Please don't wait for the fever to rise. Whenever there is fever, and when you feel that the child is sick, is going to become more sick because of this fever, make every attempt to bring down the fever. Take the help of the healthcare practitioners and bring down the temperature. And remember, most of the time, when for the first time these febrile seizures occur, obviously you will be scared as a parent, you will be very petrified, but please do not panic. Most of the time the seizuring activity stops and child returns to normal activity, starts playing. So please do not get panic. If there is seizuring activity, let the seizuring activity take place and subside. And most of the time, by the time the child is brought to the healthcare facility, to a doctor, the seizuring activity would have already subsided, and the child would have regained to normal health and would have started playing and talking. So please do not panic. It is only in very few cases the child develops recurrence of seizuring activity within the 24 hours. In that case also, please do not get panic. Please do not try to do anything. At the most, you make sure that your child lies down on the left side of the body. Turn the child to the left side, so that the saliva, if at all is there, will drool towards the angle of the mouth, and the child will not get aspirated. If your child is wearing any tight clothing, release the clothing so that the clothes are loosened, and make sure that the child is made to lie comfortably on the left side of the body without making the place congested Please make sure that the bed where the child is lying does not have any other objects, any other sharp objects, and make sure that the place is not overcrowded. So remember, whenever there is febrile seizure, even if the fever has subsided, even if the seizuring activity has subsided, you once please take the child to the healthcare facility. See a doctor to find out the cause of the fever. When the cause of the fever is found, the doctors can treat, and so that the fever will be reduced. And if there is recurrence of seizuring activity, then you have to surely see the doctor. And when there is recurrence of this febrile seizure, even in the next episode, then you have to surely see the doctor. And when there is recurrence of another episode of febrile seizure, then the doctor will prescribe, apart from antipyretic, a very short duration of anti-epileptic medicine that needs to be taken during the next episode of fever. You should not wait for the fever to rise maximally. During the next episode of fever, when there is sickness in your child, when you notice, and when there is fever, you have to start the antipyretic medication and anti-epileptic medication when you know that your child has recurrence of febrile seizures. And these anti-epileptic medications are given for at least 3 to 5 days only. But remember that more than 90% of the children between 6 months of age to 5 years of age, they do not have recurrence of febrile seizure. So nothing to worry. But still, when the child has had even the first episode of febrile seizure, even the seizure has subsided, you have to see a doctor once for analysis, for investigation, for evaluation, to see and find out what kind of fever is this, what caused the fever, so that the cause of the fever can be treated. And remember, most of the time in the simple febrile seizure especially, no anti-epileptic medication is needed. It is just antipyretic, cold sponging to bring down the body temperature, and reassurance and explanation to the parents is needed, to comforting the parents is needed, and there is no need of any long-term anti-epileptic medication in a simple febrile seizure. But in children who have recurrence of febrile seizure, those parents needs to be very, very careful. And in the next episode of fever, when the child starts having fever, you have to immediately start the antipyretic medication which the doctor would have prescribed. And in the recurrent case, which is a known case of recurrence of febrile seizure, doctor would have prescribed anti-epileptic medication which will be taken during the course of that fever episode, especially for 3 to 5 days. And once that fever episode has subsided and got well, that antipyretic and anti-epileptic medication also need to be stopped in complex febrile seizure. So next time when your relatives or any one of your child has febrile seizure, do not panic. Let the seizuring activity settle down by own. Don't try to put spoon into the mouth. Don't try to put anything to the child, or don't try to even rub the child. Just let the febrile seizure subside on its own. It's a self-limiting febrile seizure. The child will get well and will return to normalcy. Only in complex febrile seizure, that means the seizuring activity lasts more than 15 minutes and there is recurrence of this seizuring activity within the 24 hours, those parents of the child have to see a doctor and get the proper necessary advice so that this recurrence can be prevented during the next episode of fever. So I hope you have now known properly what is febrile seizure, what needs to be done, and I am hopeful that this episode was useful to you. So if you are visiting my channel for the first time, please like, subscribe and press the bell icon so that whenever I upload a new video related to health and health issues, you will get the latest notification. Thank you very much for watching. See you in the next video.